everyone, and welcome to my weekly Sunday 9 p.m. live video. I'm Dr. Tan Yiping, consultant obstetrician and gynecologist. Hi, so now today I'm going to talk about cervical cerclage in relation with miscarriages and preterm birth. Okay, so I'm going to first tell the difference between miscarriages and preterm birth. Miscarriages is defined by any baby or pregnancy that is lost 22 weeks and below. 22 weeks and below. And then preterm birth is between 22 weeks up to 37 weeks. Cervical incompetence is when the cervix, where is the cervix? So when you have a uterus, you have a cervix. So when you have a uterus, the cervix is the lower part that opens during childbirth. It opens during childbirth, that is the cervix. So when you have a pregnant mother, where her cervix is too loose, because cervical incompetence means the cervix is too loose, easy to open, so that's why they lose their baby. So you see, when we talk about miscarriages, earlier on when I talked about miscarriages and recurrent miscarriages, I was pointing out very specific to miscarriages that happen like before 12 to 14 weeks. Because miscarriages that happen in the first trimester is very unique in itself. It is usually, when people talk about miscarriages, we usually talk about the first trimester miscarriages. So, but for cervical incompetence, it is usually mid-trimester loss. It is mid-trimester loss means it's after 12 to 14 weeks. It doesn't happen before. It happens after 12 to 14 weeks, and they lose their baby because of cervical incompetence, which means that the cervix loosen and the baby pass out. So you can have miscarriages because of cervical incompetence if it happens between 12 weeks to 22 weeks, or you can have preterm birth due to cervical incompetence if it happens after 22 weeks to 37 weeks. So it doesn't matter when it happens. If it's cervical incompetent, it can happen at any of this period, but depending on which period, we call it miscarriage or preterm birth. So, but main thing is we are talking about cervical incompetence. So cervical incompetence actually means the cervix is too loose. So what could have causes the cervix is too loose? Number one is genetic. Some people is purely genetic. They are born like that. They have an issue with their uterus or the uterus and the cervix that cannot function like normal. So their cervix is too loose. So when their cervix is too loose, it opens easily. Some of these people in their first pregnancy, you somehow envy them one. You know, they are like almost term or borderline premature, maybe 35, 36 weeks, and then enter hospital within 1 hour like give birth. People will envy, oh your first time baby also give birth so easily. But actually it could be that the cervix is very loose. They may have some cervical incompetence. Cervical incompetence usually worsen with the number of pregnancy. So the first pregnancy, maybe they can still give birth at 36 weeks, and second pregnancy become 32 weeks, third pregnancy become 28 weeks, and it goes earlier and earlier and earlier with each pregnancy, because it usually worsens with each pregnancy. So the first reason, it could be just genetic or hereditary or congenital, whatever you call it. They are born with it. These women are born with cervical incompetence. So the other group of people who have cervical incompetence are people who have done something to the uterus. Sometimes we do certain procedures, like for example, you have a growth, you need to go and do a surgery, or your pap smear is abnormal, you need to do a surgery, or you had a miscarriage previously, you had a D&C done, which is again a surgery. Sometimes when you do surgery to the cervix, okay, to the cervix, if you do the surgery to the cervix, then it has a potential of weakening the cervix. Potential, it's not a must. Not everybody has surgery will have cervical incompetence, but it has a potential of weakening the cervix. And the thing is, there's no way we can test. So there's no way we can know until you actually get pregnant. So when you actually get pregnant, how do we know that you have cervical incompetence? There's a difference between people with cervical incompetence and the people without cervical incompetence, how they actually give birth. So normally, typically how we give birth, we go to hospital, we have certain signs of labor like birth show, where you have the passing of some mucus blood, or you have your water bag break, and then you go to hospital. And then after you go to hospital, you have subcontraction pain, and you wait and wait and wait and wait. You wait for hours and hours and hours and hours, and half a day, 8 hours, 10 hours, 12 hours, then you give birth. So this is typical. But in cervical incompetence, they usually don't feel anything. Sometimes they don't feel anything at all, and then when they say they got birth show, they go to hospital, they are like 9 cm, 10 cm, and then you look at them, any pain? No. Any contraction? No. They don't feel much. Maybe they feel little bit, but they don't feel much. And they will just suddenly, when they feel it, they want to pass motion, and then they give birth. Because when it's due to the cervix loosen, normally you don't need contraction. You don't need contraction to give birth. So that is very typical of cervical incompetence, number one. Number two, it tends to happen earlier and earlier and earlier with each pregnancy. So it's actually very distressing to some of these women, especially some of them, they have quite severe cervical incompetence. Some people, they have very severe incompetence, which means that they can end up delivering the baby only at maybe 26, 27 weeks. And if it's 26, 27 weeks, still okay, you know, you can still survive. But the next pregnancy, they end up giving birth at 23 weeks, then maybe cannot survive. And the next pregnancy, 17 weeks, cannot survive. In fact, many mothers or couples with cervical incompetence, they are very stressed. They are very stressed because they're pregnant for like months and months and months, and then one day the baby just pop up and come out, and there's nothing we can do because baby already come out. And there's a difference between the miscarriages that we always talk, like those first trimester miscarriage. Usually in first trimester miscarriage, the baby is usually like no heartbeat already, then only miscarriage. That is the ones that happen in the first trimester. But with cervical incompetence, they actually have the miscarriage with a live baby. That means today I scan is still alive. Then suddenly you have birth show, you go to hospital, doctor tell you already 10 centimeter dilated, your baby is coming out soon. And they scan, the baby is still alive. But after they give birth, if the baby is big enough, the baby will still be alive. But if the baby is too small, like 17 and 18 weeks, the baby will die. The baby will be born but not alive. So it's very sad because it was originally a healthy pregnancy and the baby was 100% healthy and alive. So it's very stressful. It's very stressful that every time they get pregnant, they're very stressful. The moment they get a slight contraction, they're worried. But actually, there are ways to solve it. That's what we do. We do cervical cerclage. Cervical cerclage means we tie the cervix. Sounds simple, but there are some problems with it. Because there are two types of cervical cerclage out there. So depends on your incompetence. Honestly, there are also many degrees of incompetence. If let's say you have incompetence, but you tend to deliver like 34, 35 weeks or 32 weeks, not too difficult, not too bad incompetence. Sometimes I don't even need to do a cerclage. Maybe I just need to give you a high dose progesterone throughout your whole pregnancy and hold the pregnancy. And it can. Many of the mothers in my hand, I have managed to hold them until 36, 37 weeks. Just by medication and injections only. No need tablet at all. But some incompetence are very, very advanced. Very advanced one. That means very severe one. So they deliver very early. They deliver like 23 weeks, 20 weeks, 18 weeks, 13 weeks. Very, very early. This group of women, of course, when they're pregnant, I will still give them high dose progesterone. But once they reach 14 to 16 weeks, we usually do a cerclage. A cerclage is a surgery where we tie the cervix. We go and stitch up the whole cervix to tighten it so that it doesn't open. But unfortunately, when we do a cerclage, when they are already pregnant, we can't do the cerclage tight enough. Why? Because a cervix has a certain length. If I tie it during pregnancy, usually we'll be tying somewhere in the middle. So we'll be tying somewhere in the middle. So we are actually only leaving this part that is tight and this part will still be loose. So very often we are only tying somewhere in the middle because it's not easy to go all the way up to the root. So we are tying somewhere in the middle because we are stitching from below. We stitch from below. So usually we only can grab this part of the cervix. We only can grab this part. We can't grab the whole thing. So some women, most people will do this first. Because cervical cerclage is very easy to do. Just go from below, just go in and just put a stitch and then tie it, that's it. But because when we are only tying this part, so this part of the cervix can sometimes still open. And when it open and then look like baby is going to come out, we have no choice, we have to cut off the cerclage. We cannot stop the baby coming out when it's already going to come out, because we are afraid that if we don't cut it off, then the contractions start to come in and then the uterus will just burst, explode. Because something has to go out, but you tie it and then it explodes somewhere else. So we cannot. That can be life-threatening. So other than cervical cerclage, the other option is to do abdominal cerclage. Abdominal cerclage is the one where we can tie at the root. So the whole cervix is tightened. Abdominal cerclage have to do before pregnant. So most of the time, these women already come to us and they'll tell us, "Doctor, my last pregnancy is a premature birth." Then we were like, "Premature birth, can you tell me your story?" And then typically they will tell the story, how they end up having no pain, nothing, and then they have birth show or the water bag break, and then go hospital already 10 centimeter, they got no pain, and then they give birth. So this is a typical story. And then once they tell you the story, there's nothing you can do already. You can only do high dose progesterone. You can also put in a pessary, or you have to do this cerclage, cervical cerclage from below. But all these are not that safe that effective. It helps in more than 50% of cases, actually not bad more than 50%. But there's still around 40-50% that will still have a miscarriage and still have a premature birth because of cervical cerclage. So in these type of cases, what they need to do is to have an abdominal cerclage before the next pregnancy. Before the next pregnancy. So what happens in abdominal cerclage is we actually have to do a surgery. That is, we poke 3 holes. We do like laparoscopic or robotic. We poke a few holes in your tummy. We go inside and stitch up the cervix from tummy inside. Because when from tummy inside, then it's higher up. Then that one is more secure. You can either do it with an open surgery or laparoscopic or robotic. Normally we prefer laparoscopic or robotic, but it has one problem. When I already stitch it up, you see, if I do cervical cerclage, it's from below. Suddenly you go into labor, I cut it, I open it up, I let you give birth. But when I do abdominal cerclage, which is from the tummy inside, you cannot have natural birth already. So when the time comes when you're going to give birth, you have to have a cesarean. You see, pro and con. So sometimes, even I offer my mothers, do you want to do abdominal cerclage or cervical cerclage? Then they will always say, yeah, I try one more round lah. Because they don't want to go for a surgery, you see. Because abdominal cerclage means I have to poke 3 holes and go and do a surgery before you're pregnant. And then when you give birth, I also need to do Caesar. So you have to do 2 times surgery inside your tummy. So a lot of people will be like, I try one more time lah. And then they try one more time, then they will do a cervical cerclage. If they are lucky, okay lah. But if they are not so lucky, then what will happen is they will end up with another miscarriage. So this is a picture I want to show you. This is a picture I want to show you. So when you do cervical cerclage, you will actually be doing it at lower level, just like in this picture. So when you do abdominal, you can go higher up. We want to do it as high as possible so that it's more secure and the baby is up here. So if you do it at during your pregnancy, you'll be stitching down here. But then if you do abdominal cerclage, you'll be higher up. So this is the difference. So some patients, some mothers, they will usually most mothers, they will try a cervical cerclage first lah. And then after the cervical cerclage, many are devastated. But normally I tell them, don't worry, you still got one more thing you can do. You can always do an abdominal cerclage. And there are also some people, because their incompetence happens so early, they actually deliver like 12 week, 13 week, 14 week. And then for 12 week, 14 week, it's too early to do a cervical cerclage. So they actually have a miscarriage before even the cervical cerclage is placed. So in these type of cases, actually we will advise to do an abdominal cerclage, where you do the cerclage before you're pregnant and not only after you're pregnant, which is more secure. One more thing I have not mentioned, actually incompetence can assess one. Well, how we assess incompetence and how we predict incompetence, we can't do that before you're pregnant, but we can do that after you're pregnant. Normally when we scan, we rarely do this internal scan. We only do internal scan for people who have premature birth lah. So what we do is we do a vaginal scan, internal vaginal scan. When you do an internal vaginal scan, you can actually see the cervix already start to open, because the cervix don't open like that one, yeah. The cervix open like that one. So if we can see the cervix slowly opening, when you see the cervix slowly opening, we know already this person got incompetence, especially if this slowly opening happened too early in the pregnancy. You see this cervix opening at 35, 36 weeks, that is normal, yeah, normal, because you're going to give birth. But if you did see this happening like 14 weeks, 16 weeks, you're in trouble. Fast, go and stitch. But as I say, we don't do this scan routinely in all pregnancy. In fact, world bodies are trying to push for this. Actually, they're trying to push for it. They're trying to push for gynaes to do this scan, because it's such a simple, just a scan ma. It's so simple, you can just do. And then if you do, you can prevent a lot of premature birth and early, mid-trimester birth. But we are still not doing it. People are still pushing for it, and in fact, if that become a normal practice, that would be the best, because if we scan, we know early, we can prevent the first premature birth. Usually what happens is they have one premature birth first, then only people know, hey, you got cervical incompetence. So next pregnancy, I need to scan you internally again and again and again. That's what we normally do after the person already have one premature birth. Okay, for those of you who have missed my previous videos, I have video on premature birth, preterm labor and preterm birth. I have a previous video on miscarriages and pregnancy loss. I also have a previous video on recurrent miscarriages. So typically for cervical incompetence, they have recurrent, premature birth and miscarriages, depending on when it happened. If it happened after 22 weeks, we say it's a premature birth. If it happened before 22 weeks, then we say it's a mid-trimester loss. So depending on when it happened, so then we call it differently, but actually what they have is cervical incompetence. So if you have missed my previous videos on miscarriages and preterm birth, do go to my YouTube channel and look for the video, yeah? And remember to subscribe and like my videos. Thank you. Elaine Liao asks, is RRB pessary better or cerclage better? As I mentioned earlier, it all depends on your stage. I have some patients, that's what I do. I just give them high dose progesterone, give them a pessary, and that is already enough. But usually these women, their incompetence is not very bad. It's not very bad. So let's say if you're the type of people that actually have cervical incompetence, but normally even if you give birth, it's like 28 weeks, 32 weeks, that one okay lah. We give you hydroprogesterone, we give you pessary, we can hold you on until slightly bigger, which is more than fine. But some people, they can have cerclage as early as 16 weeks, 17 weeks, 19 weeks. All these are very extreme incompetence, and sometimes in these type of cases, cerclage should be more important. Sad to say, very often we are like try and error. We try pessary and high dose progesterone and see what happens. Then you are successful, okay lah. Next time you're pregnant, we still do that. Next time you're pregnant, we do that again. But sometimes then not successful, then only maybe another pregnancy, then we do a cervical cerclage. That's why I tell you, it's very stressful and very tiring one. Can you imagine the first pregnancy, you don't even know that you have incompetence, and then you ended up have a premature birth. Second pregnancy, then somebody put you on high dose progesterone and pessary and hope that it worked, but then it didn't work again, you have a premature birth. So third pregnancy, you're going to have a cervical cerclage, and then who knows, again doesn't work, and then you again deliver early, and then the fourth pregnancy only you have an abdominal cerclage, and then only you successfully give birth at a mature date. Imagine four pregnancies, 4 pregnancies before we can hold you to full maturity. So it's actually very stressful to some women, especially those extreme ones. If not so extreme, not too bad lah. Your baby is still alive and will grow up. Yeah, premature, go high CU, stay in high CU for a couple of weeks, but eventually your baby still come home to you, right? But in some cases, because they usually born like 24 weeks, 22 weeks, 20 weeks, actually most of the time the baby don't survive. So it's very sad. And it's very stressful, because they give birth, the baby is alive, and then after that the baby died. So it's actually very stressful for this bunch of women. So, and they go through so many pregnancies, because we are trying out 1, 2, 3, 4. Why we never straight away do abdominal pregnancy? Because it's invasive ma, right? It's invasive. Now you need to do a surgery before even you're pregnant, and then during pregnancy you only can give birth through cesarean. So it's invasive. That's why people don't jump to the fourth one straight. The third one, cervical cerclage, half mildly invasive but not totally invasive. So, but it's still invasive ma. Okay? So we always try not so invasive one. We give you high-dose progesterone, we put you on pessary. So this one not so invasive. But if you're not so bad, can lah. I have a couple of women that 2-3 pregnancies, no problem. You just give them high-dose progesterone, put a pessary and fine. But not everyone is so lucky, because some people, the severity of the incompetence is more than the rest. What are the symptoms of cervical incompetence, and what circumstances will we need to do a vaginal scan? There are no symptoms, because usually they don't feel anything. But sometimes they can give some clue. They can give clue. Okay, normally they don't tell you lah, but sometimes I always feel like they give us some clue lah. Those women are just so lucky. Okay, why? Because most of the time there's no pain, there's nothing, and then one day you have some signs of labor, you go hospital and you straight away give birth. That's typical what happened. But when you have a previous delivery that is a bit early, maybe not very early, but a bit early, and it's super easy come out one. When it's super easy come out, you really have to think why I give birth so easy. No pain, nothing. Half an hour give birth already. I pain also half an hour, or I reach hospital half an hour give birth, hardly any pain. Don't think you're so lucky. Think. Maybe you have incompetence. But the first pregnancy maybe not so bad, so you can still last like almost near the due date. Maybe you can reach, maybe only early by 3 weeks, 4 weeks, or 5 weeks only. So you have to think, okay, so you may be so lucky, but it may be because you have mild incompetence, and usually incompetence worsens with each pregnancy. So the next pregnancy is when you need to take care. Okay, the other thing is some people, they have these certain clues, because incompetence means the cervix open ma. When the cervix open, it tend to have a little bit of bleeding. So actually a lot of these incompetence, they actually give us clue already. They have this little bit of bleeding. You know, it's like sometimes you have little bit of bleeding like 28 week, 27 week, and then doctor scared, yeah, everything normal lah, nothing lah, go home. Actually some of you actually got incompetence already, but maybe nobody detects. So if you have little bit of bleeding, you need to be suspicious. You need to actually do an internal vaginal scan to look for any possibility of cervical incompetence. Alright, so once again, if you missed my previous videos, you can go and see. I have video on premature birth and preterm labor. I have a video on miscarriages, as well as also a video on a recurrent miscarriage. Okay, so that's all for today. And if you have not subscribed, please subscribe to my YouTube channel, Dr. Tan City Clinic. And also please like my video. Okay, that's all for today. Bye bye.